So let me get, well, perfect. Good morning, everyone. Welcome to the Direct Care Workforce Collaborative's new schedule, too. Kicking off in January this year. We're excited. We hope you're having a great new year so far, and we're so happy you found us today. We have a very full agenda, and so I'm just going to give us a quick overview of the agenda really quickly and then hop into some housekeeping. So we're going to do our welcome and our attendance, our polls, basically get folks settled for the meeting. We have a quick update from our Community First Choice team. Maddie's going to be here to give us an update on the difficulty of care. Then we have Tiffany from the department giving us an update on the Medicaid access rule, and the IPAC, the Interested Parties Advisory Group, have an update on that for y'all. Then we're going to spend some time with our HICPUP workforce team doing a 2025 year in review, all the great things we did in 2025 and what that looks like, and then kind of what that gears us up for 2026. We have some information on the care worker tax credit that's kicking off this year as well. We want to talk to you all about Direct Care Worker Appreciation Week, which will be happening in April. And then we'll allow folks to share some updates and resources and information in our open forum as well. So lots of great information today, going to move us pretty quickly along just to keep us on schedule. And so just some quick housekeeping. We are recording. These do get posted to our Direct Care Workforce Collaborative website. So that's just a reminder to be cognizant of the information that you're sharing out, especially any protected health information that allows us to go ahead and post it, which we love being able to do for folks who aren't able to join us in real time. You're welcome to use the chat. I have several coworkers here that are helping me manage the chat. You'll be able to ask questions. You're also welcome to unmute your line as well. We should have time for questions for our presenters today. The slides will be posted along with the recording on that Direct Care Workforce Collaborative website, which I'll drop in the chat right now. Also in that chat I just sent is our email address and also our Direct Care Workforce page with all the work that we're doing in this group. So if you're joining us by phone, welcome. You can press *6 to unmute your line or *9 to raise your hand at any point. I have turned on closed captioning, which you can also turn on or off on your own Zoom toolbar using the CC box. And then information for this meeting and also our action groups and any of the great resources we have can be found on that Direct Care Workforce Collaborative website that is in the chat. So with that, let us go ahead and move into, we just kind of like to level set for folks in case this is your first meeting with us. So first of all, welcome. I'm happy to have you. This is the Direct Care Workforce Collaborative. This is a quarterly information dissemination meeting where we bring all the information to you about what's happening in this space, both within the Department of Healthcare Policy and Financing, but also within other state departments, other areas where this work is happening. We really like to use this hour and a half together quarterly to share all the updates with you. And then we do have action groups that allow you to get a little closer to the action. If you're interested in those, meet bi-monthly. And so we're actually in the middle of those right now, and I'll give you a little update on what those look like and how to join those if you're interested a little later. But those action groups are training and career advancement, compensation and benefits, and value and awareness. We are stakeholder-led and HICPUP facilitated. And so I see a handful of our stakeholder co-chairs in the room today. I have a slide introducing a handful of those that I'll share with you as well. And so those co-chairs help us determine agenda topics, discussion topics. They help keep the information relevant to you and keep the discussion going, especially in those action group meetings. Each action group has 2 stakeholder co-chairs. And so we're really happy to have them. They're volunteer and they keep us on track, which is great. The purpose of the collaborative and the action groups is really to reinforce the Direct Care Workforce Collaborative purpose and vision, and that is ensuring information is disseminated and we help build recruitment and retention of our direct care workforce here in Colorado. And stakeholder voice is key. We love these meetings to be open for you to have questions, for you to share resources, for you to network. And so we really welcome collaboration in these meetings. Just a quick look at our Direct Care Workforce Collaborative leadership team. These are our action group co-chairs. A special welcome to Jen Perez. She just joined us as a value and awareness co-chair. So I see Jen on camera. Thanks for joining us, Jen. We have Pascal joining her with value and awareness. Ashley Weber and Britt Chavez are compensation and benefits co-chairs, and then Bobby Christensen and Galen Pereira for training and career advancement. So we have a lot of great information and knowledge on this leadership team, and we're so happy to have them come on board with us and help us really push this initiative forward. I am going to go ahead and launch some polls really quickly before we get into content. These just help us make sure that we're reaching the right folks and we're bringing new people to the table and hearing from everyone we want. So the first one is really going to be, where are you located? What region do you represent? And we know a lot of folks work statewide, and that's okay. Just go ahead and report for me where you live and where you're joining us from today. We will give folks some time to answer there. All right, and that seems to have leveled out. So I'm going to go ahead and end our poll. Maybe for the first time ever, we don't have anybody from Region 2, which is really interesting to me. And so great representation from Regions 1, 3, and 4. A few folks joining us from 5. Welcome, happy to have you. And then we continue to kind of struggle in that Southwest region. So again, that's something that the action group co-chairs are looking at some outreach in those areas and just seeing if we can get folks from that area to come and be heard and learn the information as well. So pretty typical there, except for our missing Region 2, which is really interesting. The second one is how you identify on the direct care continuum. How are you interested in our work? What brings you here today? Right, and that has stabilized. So again, I'm going to go ahead and end and share our results. So we have some workers joining us today. Thank you. Happy to have you. A few folks who receive services, some advocates, employers, always well represented in our government orgs, our government agencies and trade orgs. And so, yeah, thank you for being here. This is a great look at kind of who's joining us today and just the full gamut of folks that we welcome to this meeting. It is open, so if you have an interest in direct care work or you know someone who does, invite them. Have us come join us. We love having new folks. All right. So I think that is it for my welcome and attendance and polls. And so I am going to pass it over to Maddie here to give us a quick update on difficulty of care and CFC.
Great. Thank you, Brooke. And hello, everybody. My name is Maddie Cortaro. I am a policy advisor on the Community First Choice implementation team. So I'm here to give a quick update on difficulty of care and Community First Choice. So next slide, please. So a little bit background for what difficulty of care is. So per the IRS statute section 131 and then notice 2014-07, difficulty of care is a tax exemption for live-in caregivers that provide extraordinary care to foster care and or HCBS waiver members. And services that previously qualified or that members previously claimed as for the difficulty of care exemption under HCBS waivers are services that now moved to Community First Choice or CFC. So HCPF requested a private letter ruling from the IRS asking them if the same exemption could apply to the same services that are just now moved to that CFC program. So next slide, please. So good news is on December 12th of 2025, we received a favorable decision from the IRS on our private letter ruling request. So the IRS indicated in that private letter ruling that payments for select CFC services to live-in caregivers can be considered difficulty of care payments and excludable from federal income tax under that section 131 of the Internal Revenue Code. Next slide, please. So the private letter ruling, there's a few links on this slide. So I don't know, Brooke, if you could, or someone from your team can plug those in the chat.
Absolutely. Yeah, we'll do that.
Okay, thank you. So we have the private letter ruling, which is posted, and in that private letter ruling, the IRS stated the following. So number one is that Medicaid payments made under CFC to live-in caregivers for extraordinary care, which is care that is related to an individual's disabilities, that are provided by an individual, whether related or unrelated, who resides in the same home as the care recipient. So, for example, in this case, this would be the member on Community First Choice, will be treated as difficulty of care payments and excludable from the gross income of the provider, the caregiver, under Section 131 of the Internal Revenue Code. Number two, they stated that the live-in caregiver is not required under Section 6041 or 6051 to report these payments as wages subject to income tax. And number three, that the live-in caregiver may treat payments to providers or caregivers as excludable payments described in Notice 2014-7, which is essentially the notice that applied that section of the Internal Revenue Code to waivers. And they also said that provider agencies or FMS or financial management services contractors may look to, there's a really helpful Q&A about Notice 2014-7 that people can look to for guidance. I find that Q&A most helpful, but ultimately, and if you go to the next slide, please. Ultimately, the department cannot provide tax advice. We can just provide you with the resources that have become available to us, such as the private letter ruling. We created an informational memo, which can be used by individuals, but ultimately we recommend that you consult with, as a caregiver, your provider agency or FMS contractor, and or consult with a tax advisor. And we do have, through the Department of Revenue, some low cost and free tax resources. But ultimately, this ruling, the private letter ruling, applies to the 2025 tax year. So if the member was on CFC starting July 1st of 2025, this private letter ruling applies to payments made in that aspect. So if wages were withheld or taxes were exempt during that time period while we were waiting for the private letter ruling, caregivers should consult with a tax advisor or their provider agency about how they can recoup that money when they file their taxes. And then any questions? So the next slide, I just plugged the resources one more time. The Department of Revenue's website, informational memo, and then if you have any like policy specific questions about CFC or difficulty of care, I have our email address, which is higpuff_cfc@state.co.us. And that is all that I have for you all.
Thank you, Maddie. Thank you so much. Any questions for Maddie? I do want a special shout out to Maddie. She came on very last minute. We plugged her in here. We're just excited to be able to share this information with you and give you the resources to be able to navigate. So if there are no questions, we will keep us moving. Thank you so much, Maddie. We appreciate you.
Thank you, guys.
All right. And so all these links will be live in the slides when we post them to the website. And I'm also capturing any that are dropped in the chat as well that will be added probably on a different slide, but we'll make sure those are all available to folks. And we do have some additional tax information kind of to share throughout this website or this webinar as well that might kind of relate to this and kind of how you can access those resources that Maddie was to speaking about. So, perfect. All right. Well, moving us into the Medicaid Access Rule IPAG update, I believe we have Tiffany. Tiffany, take it away.
Good morning, everyone. My name is Tiffany Domikos, and I am a federal policy advisor here in the Office of Community Living. I'm happy to be here with you today. I'm going to give a quick overview of the federal rule that I'm referencing, and then I'm going to give some updates about our advisory committees. So in 2024, the Centers for Medicare and Medicaid issued a final rule called the Ensuring Access to Medicaid Services Rule. This basically creates consistency across states by requiring national standards for access to care metrics, reporting on rates, advisory committees, those kinds of things, so that no matter where someone is receiving services, which state they're in, that there's consistency in how those are being measured and what's being reported to our federal partners. Next slide, please. Part of those requirements are to establish 3 advisory committees. Now, Colorado is a little bit ahead of the game because we had a lot of these already going. So the Medicaid Advisory Committee, called the MAC, is the first one. And Colorado's name for that is the Medical Care Advisory Committee. It used to be called NIGHTMAC, if you've heard of that. But this is the place where folks are giving input to improve and maintain quality for Medicaid programs. There are members and community members on that advisory committee. Next is the Benefits Advisory Committee. The one for Colorado is the Member Experience Advisory Council Alumni. So there is a group of folks who are members who who make up a council giving their experience about Medicaid. And when folks are rolling off of that committee, they will have the opportunity to join this alumni council. And this group is sort of the liaison between the Member Experience Advisory Council and this Medicaid Medical Care Advisory Committee. And the Medical Care Advisory Committee is giving updates and recommendations to HCPF about services, about member experiences. So this MEAC Alumni Council is the liaison between those. And then last is our Interested Parties Advisory Group. And this group is intended to be members, community members, and direct care workforce members who can advise and consult specifically on rates for certain services, access to care metrics, and payment adequacy. Next slide, please. So like I said, HCPF is a little ahead of the game. We met these timelines pretty easily, but both of these councils and committees are up and running. You can find more about them at the link that Brooke put in the chat. The first report for the MCAC is due this year. And so everyone is working together to come up with those reports and to give input. And the federal government does have specific categories that they have to report on. So those are part of the agendas that are being created. Next slide, please. And the major news that I wanted to provide this group is an update on the IPAG. We had sent out applications in November and had those live. We received some guidance from CMS, our federal partners, that this part of the rule is being postponed, possibly until 2029. So HCPF has made the decision to push pause on this part of the and in this implementation piece. We will be sending out information in writing by the end of this week through our what's it called? The constant contact. And if you or anyone you know has applied for the IPAG, I will be sending out individual emails to anyone who applied. to give you the information and other opportunities for engagement. And this group is actually one of those opportunities for engagement. So we will continue to be coming back to this group with updates on the access rule, updates on the interested parties advisory group, and how you can continue to engage in all of these processes. I realized I forgot to put contact information, so I will grab that and put that in the chat. We have an inbox that we're collecting all feedback and questions, so I will put that in the chat shortly. But does anybody have any questions off the bat?
You're welcome to come off mute if that's easier for you, or drop them in the chat. It looks like Elizabeth asked, are payment rules being paused too?
They are not. So the portion of the rule that was pertaining to IPAG is going to be paused, but there are other sections of payment that will not at this time. This is sort of an ever-evolving process. We're getting new direction and updates and information kind of constantly from CMS, or not. There are long periods of silence too. So we're doing the best we can to stay ahead of things, but also not wanting to get too far ahead of ourselves in case that direction changes.
Perfect. Thank you, Tiffany. Jennifer, please.
Yes, thank you, Tiffany. Just to clarify, CMS gave the word to put the IPAC on pause. Is that correct?
That's correct.
Okay, and why are they doing that? Do we know?
I can give some guesses. My guess is that that states were having a hard time with the implementation timelines. This group would be implemented before any of the reports that are required for that group would be due. So it was a little like cart before the horse. And I think they received that feedback and changed the dates for that. So right
Okay,
now,
that makes sense.
to answer Elizabeth's question in the chat too, all of that payment reporting is going to continue at this time. Again, I might come back next time and say, hey, guess what? We have another update and we're changing this. So thanks for your flexibility and willingness to hang in there with us. I know that this is, it's hard with things constantly changing, but yeah.
Thank you.
Yeah.
I understand now. Thank you.
Yeah.
And Lori had the same question in the chat as well, just if there's any guidance on why this is happening. One thing that Tiffany mentioned was that she may come back to this meeting, but we also will be pushing out updates in our OCL Constant Contact newsletter. So I'm going to drop the sign up for that in the chat. If you aren't connected with that yet, sign up for that. You'll see a lot of updates about this and also other things as well.
Sure. For sure.
Any other questions for Tiffany around this? All right. Well, hearing none, Tiffany, thank you for coming. I'm sure we'll see you again soon.
Yeah, sounds good. Thanks for having me.
Thanks, everyone. All right. Perfect. All right. So there are just a few updates kind of around stuff that's happening peripherally that might touch this workforce that we're excited to share and update with you. We're going to spend a good chunk of time here just kind of going over what our team and what the collaborative has been up to in 2025 in the last year. And so I'm going to start, and then we'll just kind of popcorn to other members of my team here to share updates and show kind of what's been happening. So I did just want to give just a quick like direct care workforce collaborative year in review. We had over 330 attendees across all of our quarterly meetings and action group meetings. And so that's exciting to know that we are engaging folks in different ways and across different avenues. Again, different regions, different across the direct care continuum. That's why we ask those questions so we can make sure we're bringing the right folks to the table. We had consistent representation in 4 out of our 6 Colorado regions. Typically, our southern regions are most difficult, but then you saw today that we didn't have anybody kind of from, which is interesting because I know Jen is in Boulder County, and so I think I'd like to amend our poll responses. But we have consistent representation from those regions. And we continue to track that as well, just to make sure that we're doing the right outreach as we need. We had a handful of presentations over the last year, including Get Ahead Colorado, which we'll hear from again this year. We're excited about that. We had Colorado Secure Savings come and talk to us about that retirement benefit. My friend Ben was a benefit navigator that came and talked to our compensation and benefits action group. We had our base wage team and our compliance team come and talk to us about that process and about the auditing process. And we continue to partner really well with our Department of Labor and Employment, including labor standards and statistics. And then we had a Workforce Centers 101. So just trying to bring the best information to you that we can, really trying to supplement what you're hearing and what you're seeing, and letting you know that there are other things kind of out there that's happening. Just trying to make this kind of a one-stop shop for you. As well as looking back, we always like to look forward on kind of what's happening with our action group. So we did meet with our action group, our training and career advancement action group, on Friday. And John from our team, who you're going to hear from here in a minute, gave us an update on how the Direct Care Career site is doing. And he's doing a badging activity with a small work group of folks. So we got an update on that. And Bobby, one of our co-chairs, helped us explore some foundational skill offerings through that Direct Care Careers. And she brought us some other resources as well, looking at some of those foundational skills, just around building rapport, communication, and that kind of stuff. So just continuing to kind of put tools in folks' toolboxes on things that they can use, whether that's workers or providers. Compensation and benefits is meeting this Friday, so day after tomorrow, and we are having Get Ahead Colorado come and present to us on tax credits and resources. Heather's going to share a little bit more about that presentation when she talks about the care worker tax credit later in this webinar, but that'll be January 16th, this Friday, at 10 a.m. Again, we had them last year. It was really well received, and with the care worker tax credit coming up this year, we thought it'd be great to have them back and really pick their brain on tax credits and how to navigate those. So looking forward to seeing folks on Friday. And then we'll have our value and awareness action group the Friday after that, so next Friday. And we're just continuing to plan for Direct Care Worker Appreciation Week. And yes, Lori chimed in there that one of the great things we did in 2025 was planned and implemented the Direct Care Worker Appreciation Week. I can't believe I forgot that. And so, yeah, always lifting that up and continuing to kind of plan for that as we move through this next year. If you're interested in any of those action groups, even if you're not able to attend meetings on Fridays with us, you can sign up to be a part of them, and that will get you on the listserv to get the agenda ahead of time, and then also get the notes and slides afterwards as well. And so we'd love to have you just kind of keeping a pulse on what those action groups are up to. You can sign up for 1, 2, 3, all of them. If you just want to keep tabs on what's happening in those, we'd love to connect with you. And I think I will take a pause here and hand it over to John to tell us all the great things happening at Direct Care Careers.
Hello, everyone. My name is John Hendricks. I'm the Direct Care Workforce Support Specialist, and I manage the Direct Care Careers website. If you're unfamiliar with Direct Care Careers, it is a platform that's kind of tailored to the needs of direct care workforce in Colorado's home and community-based service waivers, including consumer direct attendance services, support services, programs all-inclusive care for the elderly, or PACE, and long-term home health services. If you're not familiar with Direct Care Careers, if you're an employer, you can get onto the website, any of those waivers, and you have access to the site. You can get on and post jobs and be automatically matched with workers that are already on the site. You can also go through our trainings, which are all free. We have the Colorado Direct Care training on there, foundational skills trainings and career pathway trainings. We also have a resource library with over 600 resources that really are there to help direct care workers and employers in various different aspects of their work. For direct care workers, we have resources on there for their personal lives, like housing resources, insurance, all of those types of things. We also have resources for employers, like how to prevent burnout and how to recruit folks, as well as for direct care workers in their work lives, like if they need a refresher on how to transfer someone from a bed to a wheelchair We have great videos from Craig Hospital on there, just to refresh folks on those. So if you're looking for work, resources, trainings, you can get it all on the DCC, as we call it. All of the resources are absolutely free. You do not have to pay for any of those. We also have webinars that are listed on there that are coming up for live and in person and online. But to get to what we have done on the website in the past year, the biggest thing that we did was we put on a new learning management system. Basically, we made this change to just make the learning center a little bit better. We can deep dive further into reporting. We can now do badges that Brooke just mentioned, to give employers like a really be able to quickly glance at a worker's profile and see what kind of modules and certificates they've gotten. And also just to make the experience a little bit easier and more accessible. Coming on with the learning management system, we also added a new calendar of events, sort of what I was just talking about. We post webinars on that, meetings such as this that are upcoming within HICPUF, that are all, again, free. And we also, with our old LMS, this kind of goes into with the new LMS, we now have downloadable and electronic certificates. On the old LMS, they all just kind of lived on this in the system itself. But now, once you or anyone completes a training and passes it with over 80%, you are automatically emailed that certificate, so you can have it there. And you also can go to the website and download it to print it if you wanted a paper copy of it, or you can send it electronically and share it with folks through email, through social media. So that's all new. One of the things we have that just came online at the end of last year was that job postings now automatically unpublish after 90 days if they are not renewed. So if you're an employer and you have a job posting on there, it's been on there for 60 days, you'll get a notice saying, hey, renew this if you still want it on there. But if it hits the 90-day point and it's not renewed, it will be deactivated. If that's something that an employer just missed and they didn't want that, it's as simple as going in and checking a box and it will be reloaded onto the live job postings. So look out for that. And that's just a way to keep everything fresh and make sure that all of the jobs, we know that they're open. We know that they're not old and aged out and already filled. So then we also added, I think about 9 months or so, 10 months ago, we added CDOS employers to the site. And with that, we also, for every CDOS job posting that a CDOS employer posts on there, we linked the being an attendant guide. So if a direct care worker is on the site, they see a CDOS posting, they don't know what CDOS is, they can click on that, find out, and learn how to become an attendant. So really just trying to make everything as seamless and as easy as possible for direct care workers and employers. We also have base wage validation. So last year, we noticed that employers could put on job postings for under the base wage, which is not something we want. So now if an employer gets on and they try to post a job for under base wage, like say they try to go in there and post a job for $15 an hour, they will get an edit saying you cannot post a job for under $17 an hour. So no one will be able to post a job under that base wage. Again, we updated the landing page. Basically, this is just more better information, more accurate information about what the website is, how people can use it, just for accessibility. Speaking of accessibility, we did a website accessibility and usability update. So some of the feedback we got was a CDOS user was on, they were trying to use it, the JAWS reader was getting glitchy and they weren't able to interact with it the way that they were supposed to. So what we did was we went back to our vendor, we asked them to do a comprehensive JAWS review. So they reviewed it, they found the errors, they corrected those. We also did another accessibility yearly check that we do every year, so to make sure that everything on the website is accessible for everyone. And now we also updated the website so that there are more time between required password changes. I think when we were looking at it last year, it was every 30 days. People were getting notices to update and change the password. So we actually got that up to 45 days, which is the industry standard. Next slide, please.
Yeah, John, actually, we have a handful of
Oh,
questions in the chat
oh,
here.
great.
So I'm
Yeah,
going
yeah.
to,
Oh,
yeah, I'm going to
for
read them
sure.
off and have, I think Heather chimed in and said she could answer a handful of them. So I'll just kind of let you and Heather kind of put them back and forth. But first is
Sounds great.
Jennifer, is there a plan to allow the education and training modules to be downloaded by employers and shared without requiring individuals to register and create their own logins with DCC?
So we can make, I mean, it is on our back burner to make the materials printable in a PDF fashion. So a provider can ask for the training the content. It would look different because it wouldn't be set up in a module. But having that content available in a PDF so that an employer, a provider employer can take that and use it as their own training resource. We are working on that. We're competing priorities. So, and then the how often things are updated is also a little hiccup with that. I think the caveat would be that the employer would be responsible for providing that certificate of completion. It wouldn't be something that we would house and have in our system because it wasn't completed through the DCC. Also, a little caveat with that is starting July, all employers in this space have to make their workers, and we'll cover this later in the presentation too, aware of the DCC. And there's probably going to be some required training on the DCC, maybe, with the Know Your Rights training. So it would behoove employers and workers and people wanting to be in this space or, interested to go ahead and log on, sign up and kind of get familiar with the site because it's likely going to be more useful down the road.
Perfect. Thanks, Heather. Um, Jennifer P. We had Jennifer B. Now we got Jennifer P. Any plans to pull some of the training from CO Train, Colorado Train, and add it to a resource? Add it as a resource to this platform.
We wouldn't be opposed to that. It would depend on the module and what the training and what the intention is for. So if the intention is for a direct care worker, and if you have some specific modules you think that would be helpful there, Jennifer, please let us know. I think we do have to be cognizant of who owns those scoring packages and in their intention, but we're happy to get more things on there so it's a centralized resource. I think some of the challenges is just making sure that the material is compatible, it's for the right audience, and that the certificates of completion look the same because there's some different wording requirements depending on the intention of certain trainings. So, but happy to look through those. And if you want to chat with us about what you're thinking there, we'd love to explore that.
Perfect. Thank you. Cindy asks, are you saying your training on transfers would meet CDPH&E's guidelines for client transfers, public health and environment?
No, Cindy, and we don't have John was referencing some training, a video that Craig Hospital put on that talks about some stuff. So those would just be supplementary resources that providers can use. There's no, all training should be person-centered and really meet the needs of that member. And so we're the resources on there, when John's talking about resources, they could be PDFs, trainings, videos that are for this line of work, but they would be, I would consider it an augmentative resource, something you can use to supplement what you also have that is very specific to that member. I know the one video that I really liked on there, it had to do with moving wheelchairs up and down like steps and some safety aspects of that. And it was just, I thought it was really helpful. It was a really good refresher, but it wouldn't replace the requirement of training somebody very specific to their needs.
Perfect. Thanks, Heather. And last question for now. Kelsey asks, is this system integrated with any other state system? Specifically thinking connecting Colorado, My Colorado Journey, anything like that?
It is not. This is not. The Direct Care Career Site is a resource and job hub within the direct care space. That is, several states participate in this. And so we are one of them. I think there's 4 states now that are participating in it through Advancing States in Alterum. So it's really more geared towards direct care, but not specifically Colorado. Each state has their own version of the system. Uh, and we use it for the way we want. I'd be happy to hear what intersects you might think connecting Colorado or My Colorado Journey and the direct care career site could have. I know they wouldn't integrate with each other because they are how they are manned and who owns them. In that's a little bit out of my realm of understanding that. But
Mhm.
I'm happy to hear from you, whether it's now or even if you want to email us or chat later
Yeah.
about what the benefits you think would be there.
Yeah, I'll
Yeah, and
jump in as
Kelsey,
really quick if that's okay. And it
please,
might be a
yes.
bigger conversation. So, specifically coming from more the workforce side of the house and thinking of employers posting jobs as well as job seekers, how are we aligning to minimize kind of the duplication? And like, is there just an opportunity? I know the state is really focusing as well of building some career pathways and pipelines within healthcare, public health, behavioral health, like in-home care, all of those pieces. And so knowing that the great work that you all do and even this direct care that is being collaborative across other states, how are we aligning and supporting both the job seekers and the employers to have those platforms? It's a wondering, right, of how are we just making more efficiency to have effective and quality workforce?
That sounds great. That sounds great, Kelsey. Thank you so much for that because I think that's something we'd like to explore too, and just understand like what that system looks like, and then how our system maybe can to supplement that or communicate that with us. So if you're interested, we'd probably love to pick your brain a little bit on what you see on your side and what might be helpful. So Kelsey, expect our team to follow up with you on that. Perfect. Oh, and I saw you left your chat, you left your email in there for us. Thank you so much. And Cindy, just a comment that may be confusing to employees. I would recommend a disclaimer that the video or PDF is not considered an official training for resources. So just a comment there, feedback.
Yeah, and I will say on that, Brooke, there is a disclaimer on there saying that these are external
Okay.
websites and they're used for just resources. They aren't part of the online trainings or anything like that.
Perfect. Great. Thank you, John.
Yeah,
All right. Thanks for your questions, everyone. Let John continue. I'll try not to interrupt you again.
no, that's great. No, those are great questions. Thank you all for those. Um, Lastly, I wanted this slide just kind of depicts where we were at the beginning of 2005 to the end of 2005, and kind of comparing those numbers year over year with where we were for the entirety of 2024. Excuse me. So individual signups grew from 168 to over 1,400 in 2025, which was almost an 800% increase from 2024. Right now, to this date, we now have 1,765 total users, and those are direct care workers. Employer signups increased from 45 to 75, which was 67%. Um, um, excuse me. Ugh. Increase from the previous year, and we actually have 144 employers total on the website now. And training module completions rose from 612 to over 7,000 completions. Granted, we really kicked off the modules at the beginning of last year after some sort of beta testing. So that's why that has such a huge increase. But as of yesterday, we now have 7,666 completions of direct care workers going in and completing those modules. Job postings declined late in 2025, but that was due to the introduction of that 90-day auto expiration workflow to make sure that all the job posts on the website are up to date and are available.
Perfect. Thank you, John. Those are some exciting numbers. We'd love to see that. And we just continue to have John come and brag too about the numbers on DCC. So you'll continue to see those in our action groups as well. Any questions for John and the DCC before we keep rolling? All right, seeing none. Thank you, John.
Thank you.
In 2025, we also continued our direct care worker satisfaction survey. And no, that's not a typo. We actually did have 1,234 responses to our survey this year, which we're really excited about. We did see kind of a bit of a jump in our survey responses over time, which is exciting. And we saw a pretty big jump in the number of counties represented. Over 2022 through 2024, we had 40 of our 64 Colorado counties represented. And in 2025, we were able to reach 56 of those 64 Colorado counties. And so we're pretty excited about that jump. 60% of our respondents have been in the field for over 5 years, and most provide care in private home settings. I didn't level set very well with this. I'm just going to go over some quick demographics of the survey itself, and then I'll dig into a little bit more about kind of some satisfaction and some of the benefits we saw. But so yeah, most provide care in those private home settings. And we did ask job titles, and we found that the most common job titles of the folks completing the survey was in-home caregiver, the certified nurse aide, the CNA, direct care worker, and personal care aide. So those were the ones that came through the most, because we know our workforce goes by a myriad of different titles. So we like to ask that, and those were the ones that came through the most. This kind of digs into satisfaction, overall satisfaction. On the right there, you'll see the specific questions and what folks responded, either agree or strongly agree to. And then on the left, I just did some real general themes that we saw. And so when asked if my work makes a difference in people's lives, 98.3% either said strongly agree or agree. And so we love to see such a high number on that. When asked, I feel the work I do is appreciated. 76.2% of respondents responded that they either strongly agree or agree. When asked, I feel a sense of accomplishment from doing my job. 94.7% of respondents either agreed or strongly agreed. And when asked, I feel a sense of pride in doing my job. 95.1% of respondents responded favorably with agree or strongly agree. And then lastly, we asked just overall job satisfaction. And so when asked how satisfied they were with their job, 83.9% of folks said they were satisfied or very satisfied. Some of the themes we saw, we did have an open box where people could leave comments and questions. We really like those to remain as anonymous as possible. So we really just look through for themes that people are saying. So some of the themes that we were able to pull out, people really enjoy making positive difference in clients and members' lives. A lot of folks see this as a great way to get started in the healthcare field, so kind of that career pathway lens. A lot of folks are reporting that they enjoy being able to kind of control their schedule and flexibility and supplement maybe other stuff they're doing, whether that's other work or school. And then this one, they feel proud when members are excited to see them on the days that they work. And so really just kind of going through that, being excited to go to work and knowing that you're really making a difference. So those were some general themes that we were able to pull out of the open comment section around satisfaction. If you've been around us and our satisfaction survey, it's kind of evolved over time. And we found the first year or two that folks were somewhat or mostly satisfied with their wages, but benefits were a big concern, that they weren't having either no access to benefits, or they maybe didn't understand or couldn't afford the benefits being offered to them. So we started kind of digging in more into what the benefits landscape looked like for these folks in our surveys. And so we just pulled some quick stats really quick about the percentage of direct care workers who do not receive this benefit. And so these are the number of folks that just report, I don't even get this benefit, it's not offered to me. I will note that we saw quite a large jump in the retirement. Folks reporting in 2022 through 2024 that they did not have access to retirement. It was in the 60s, in the high 60s. And so we're now down to 57.5. And we're thinking that's probably because of Colorado Secure Savings coming into the picture and allowing kind of an alternative retirement option for folks that maybe didn't have it before. I also have just a few other notes on some changes here. Let me pull those up for us. Too many windows open here. So medical is trending in a better direction. from 2023 and 2024 specifically. So we have a little bit better increase in access. And so a lower number of folks are reporting that they do not receive medical. And so we see obviously that the highest ones are really that life insurance, those long-term disability and short-term disability, kind of those that additional package outside of the traditional medical, vision, and dental insurance. And so really nice to just kind of be able to keep track of this as we move forward. And see this kind of year over year changes, like being able to note like, hey, the retirement change, maybe why did that happen? What happened in this workforce that maybe would lend itself to help us understand why retirement changed? I see, Laura, you have a question. Is there any difference in those having medical coverage compared to previous years? Yes. Yeah. So being able to kind of track the trend that more folks are reporting that they at least have access to that benefit. Now, we don't really dig into, whether they're using it or if it's a high deductible plan or not. But we are just asking really basic questions of like, do you even have access to this? Would I be correct in thinking they're at least eligible for short-term disability plan? That is a great question, Lori, that I cannot answer for you. I will say though that if that's correct, there's at least probably 67.1% of folks that maybe don't understand that's available to them. And so maybe that's something that we try and connect folks with a resource. Like you maybe it's like Colorado Secure Savings, right? That's kind of like supplementary or something that's available that they just don't have access to. And so that I'd be really interested in learning. Yeah, would be a great education topic. Absolutely. So let's dig into that. And maybe I'll talk with Ashley and Britt, our compensation and benefits co-chairs, kind of about what that looks like and what resources might be available. And to that point, too, if others are seeing like, well, I think they maybe have access to life insurance through this program or something, let's dig into those a little bit more. But I appreciate the call out there, because if we don't know, then there's a chance that maybe workers don't know or employers don't know, and we want to connect them with those resources as well. So Cindy, they have access to Colorado paid family medical leave. Yes. Okay. Yeah. And so maybe the point is then trying to understand for workers, for employers, what that entails, what exactly that means. Because, we have this benefit and we say it's available and stuff, but what does that mean for folks? What does that mean on the ground level of what they can access and what's available to them? So great education topics. I think something we'll want to dig into either at this meeting, at this larger meeting, or one of our action groups can dig into that too. So again, these are just what they think they have access to, what they're reporting to us, and what we're seeing there. And so some places for some education. All right. So next steps of this direct care workforce, direct care worker satisfaction survey. We're working on a 2025 survey report that'll have all the information that we kind of previewed for you today and dig in a little bit more. We have all the data, it's available to us, and we're just putting in a report form, and then that will be posted to our website. We have the 2022 through 2024 version already up. That you can take a look at the first couple of years of that rendition. Again, it's changed a little bit over time, and so that's why we're having 2025 kind of as a standalone report versus a year-over-year report, but we'll certainly make note of the changes that we've seen from that initial implementation of the survey. We will continue it. We brought the surveys in-house, and so we'll continue to run it in 2026, typically in the fall. We try to be really careful about survey fatigue and make sure it's not running at the same time a whole bunch of other surveys are running. We also try to leave it open for a good chunk of time. So we will work on getting that information out to you all. But yeah, in the meantime, check out the one from the last couple years. And as always, keep visiting us here at the collab, the action groups, and then staying engaged with that OCL newsletter as well. When that report is final, it'll go out in the newsletter and be posted there, and then we'll continue to update these groups as well. But really excited to be able to just share some previews. And again, to Lori's point and Cindy's point, some education points that we can bring forward for folks and kind of help fill the gap as to what they understand that they have or don't have. Year-over-year data is wonderful. And yeah, so I'm going to take a break and hand it over to Heather to talk a little bit more about what happened in 2025.
But wait, there's more. So I wanted to talk about House Bill 25-1328, and I know there's a few of the board members here. So I can always tap them for questions if you have any, but just kind of want to go over. The bill is titled concerning, oh, sorry, I was reading too slow. The implementation of the recommendations made by the Direct Care Workforce Stabilization Board. So just kind of go over who does what as the timelines for this are coming close. All right, next slide, please. So we divided it into a few slides. So the first slide, and this is based off the bill language, what the Direct Care Workforce Stabilization Board is responsible for, what they will look into. And if you don't know, the makeup of the board is pretty specific. They have representation from different folks and different roles on there. So the board will look into how healthcare costs in the industry compare to similar industries, how family caregiver models affect insurance costs and Medicaid rates, ways healthcare benefits could be paid for, kind of segues into what Brooke was just talking about, with the direct care worker satisfaction survey, and then also look for how to identify innovative approaches related to quality care, to care quality and cost. So those are just tasks from the board itself. And then on the next slide, sorry, I'm working through some cold and sinus problems here. One of the state departments specifically called out in the bill is the Colorado Department of Labor and Employment and what they will do. So part of their tasks are develop and provide a statewide Know Your Rights training for direct care workers. It'll be offered at no fee. So there's no cost for employers and providers to have this training. Always want to have the caveat is if it's required training, it has to be paid. So providers still have to pay their employees to take this training. So just noting that there. The training will have a certificate that'll be provided upon completion. That's important because workers need to show that they've had this training already if they're going to a new employer or an additional employment. And the worker organization and the board is helping CDLE with the development of this training. So, making sure that they're covering aspects that are important to members of the board and the worker organization. So the next part of this is it requires employer compliance. So employers must ensure all direct care workers complete the training. And so when it gets rolled out, there's a time frame of when it'll be rolled out, and everybody has to have that training. Provide compliance assistance to employers and workers, and also investigate and enforce penalties. So, and you can look at the bill, it's kind of chopped up there in areas. So just kind of pointing out there's going to be a Know Your Rights training coming. It's going to be required for folks in this space, and it's going to be tracked in the sense that you need to have your certificate so that you don't have to take it again when you go to a new employer. And then on the next slide, we will talk about the HCPF requirements in the bill. Create and maintain a website and communication platform, direct care workers. We are working on the website. I think of it as, so we already have the communication platform, and the best way to think of that is the DCC, direct care careers. That platform has the ability for us to send out communications to workers, to individual users signed up there, to employers signed up on there. So we have a way to get communication out to folks who are signed up on the platform. I'm going to skip ahead to one bullet point there. Manage the opt-in, opt-out choices and protect worker data. So part of this bill said that individual users for the communication platform, the DCC, can opt to have their information shared to specific people in this space who might want their information. It would be name, email, phone number, to connect with them about information. So HCPF's responsibility is to make sure that all the individual users, when they're signing up for it, they know that they're opting in to share their information or not. And so we are working with our legal team and our HIPAA folks here to make sure that we have the wording right on that. We want to be careful because, as John mentioned, CDOS providers, so these are participant-directed providers, use the site. So we're just going to make sure that people's information, they know what information they're sharing, and they know they have a right to say yes or no to it. So we're working on that. When we get that language, we are going to share that back with the board for some feedback to make sure it's understandable. I'll skip back up one. develop a direct care worker notice of rights. So there's some pretty specific stuff that has to be in the direct care worker notice. We are developing this in coordination with the stabilization board. So the worker notice of rights has to have the know your rights training information. It has to inform people of the direct care worker website and the communication platform, which is the direct care careers platform. It'll on that workers' rights notice will explain how the opt-in, opt-out about the information being shared if they want it to or not. Just some direction on how to use the DCC and how their information will be shared if they want it to be shared. So just kind of a one pager that they kind of see where they can go to get some more information about some stuff. So we are working on that as well. And the job matching. So the direct care career site already does a pretty good job of the job matching. We have our training information on there. John did talk about the training calendar. HCPF itself doesn't provide like live training, but we do look for trainings that are available and for free. Also, CDLE has been doing some Know Your Rights training, so we'll put that on there. We do, I would think, have an open invitation out to stakeholders. If you're aware of a free training that you think is relevant in this space, to let us know. We're always happy to share out resources. We have to do a little bit of vetting to make sure we understand what information we're putting out, but we're happy to share those. And I guess the last thing I'll talk about is the website aspect of this. To use the DCC, you have to have a login and sign up, right? So I say it's behind a password, a password wall. The website will be, you click on the website, you kind of see where you can go for everything. Again, maybe more of a one-stop shop. It is a duplication in a sense, but it's like rounding up all the resources and information, and like, this where you go for this, here's where you go for this, here's where you go for that. So I think the idea in the bill, maybe folks were thinking like, how do we have some centralized resources? There's lots of information out there, but we just need to wrangle it for certain folks and put it in certain spaces so they have maybe a better understanding of how it affects them and where to go to use it. So that is all the stuff that we are working on with that. And then the last part I just wanted to call out, because in the bill it does talk about what direct care employers are required to do. So the bill says they are required to make sure all their workers complete the Know Your Rights training. And there is some timeframes in there, either October 1st, 2026, or within 90 days of launch, and collect proof of that training. So if you remember, we say CDLE, when they're creating the training, we have to be able to have a certificate of completion. Provide notice of rights to all current direct care workers. So that's that notice that we were having to develop. So the employers are required to provide that to all direct workers and new hires. And it just reiterated what the notice would say. And then really calling out, it's an ongoing requirement for any new worker to that employer. They're either going to have to make sure they have the Know Your Rights training done, or that they have that certificate so they can mark them off knowing that they had the Know Your Rights training done. So that is just a long-winded way of me pointing out certain parts of the bill so that you know what to put on your radar. I mean, think from July through October, we'll probably have some busy times going through all of that.
And so, Heather, if folks have questions, would you route them to the Department of Revenue, or how would folks kind of follow up on this?
Oh, for the board, the
Oh, for the Know Your Rights. Oh, I'm getting ahead of myself. I'm looking at the care worker.
Don't do that yet.
I'm going to put a pin in that.
Yeah. I think that if you have questions about this, I would say, there's not a email for the board, but I think, there's ways to get information there. I would say come to a meeting, come to the board meetings. They are on every other month on Friday from 12 to 2, I believe. So the next one is February 13th, maybe. I'll have to look at my calendar, but you can get on there on the website, come to the board, learn what's going on, and they do have recordings on there as well.
Heather, I can jump in real quick.
Yes, thank you.
Yeah, the next board meeting is March 13th. It's the second Friday. So we're still in a pattern where we're meeting every other month. The board didn't decide otherwise. So next meeting is in March. You can contact us. I believe our email at least is on our webpage. If you do have any questions, and we can guide you. I do believe the board members' emails are still
Mm.
on our website, and if they're not, then just go ahead and contact us directly. So, you can find the employers, you can find the consumers, and the direct care workers who all are on the board. So if you have questions or you want to get in contact, feel free to do that. And I did want to note, for this requirement that's in the legislation regarding the Know Your Rights training, employers who do not ensure that their employees have taken the training after a certain point could be subject to fines. So, and just know that it falls under enforcement actions through the Division of Labor Standards and Statistics if that's something that'll happen. But yeah. So if you have any questions, let me know.
All right. Thanks, Carrie. Thanks, Heather. Sorry, I fast forward a little bit. I got all this information is it's all one spot in my brain. So, all right. Any other questions about this bill? All right. Um, this is where I thought we were. Oh, hey, Ashley. Yeah, Ashley, please. And Ashley, if you're talking, oh, there you are. Okay.
Okay, I was just wondering when the employees do fill out their certificate and it is completed, where does it need to be handed in or turned in so it's recognized to know that was completed?
The employer would be responsible for making sure that the employee, the worker, has that certificate. So that would be
And
between the employer and the employee at any time they're hired.
okay, and with the legislative language, does it say that the employer is responsible for turning that into the state, or do we
No,
just put
no,
that on hand?
No.
yeah.
Yeah. You just have to know that the employee has taken the training and that they have that certificate of completion.
Okay. All right. Thank you.
Thanks, Ashley. Cindy, please.
Yes, I don't know if I missed it, but can you tell me when the information about the opting in and opting out and all the information on your side is going to be ready so employers can start to roll it out? Because I know the Know Your Rights trainings are happening. But
Well,
when will the other portion be finished?
I think we're looking at a July, we're July 1.
Okay. So will that then be in like a hick puff memo so we know, or do we just need to keep checking the direct career website?
No, we'll have to disseminate
Okay.
that we'll have to have that. Yeah, so there'll be an operational memo saying,
Okay,
hey, here's
perfect.
that notice, here's what you can do. We'll try to do a variety of messaging from that. Since we know not everyone's on the DCC site, we will
Mhm.
message stuff through that, but that's a smaller audience. And so
Sure.
I'm thinking provider bulletin, LTS SOCL newsletter, and then also through operational memos. And then whatever we'll talk about with the collab too. So we'll try some different areas.
Perfect.
Also would like to work through Alliance and
Mhm.
other trade orgs as well, and helping them radiate that message out to the folks in their space as well. So
Perfect.
if there's any place I missed, please let us know because we want to.
No, I think that would be perfect.
Okay.
Appreciate that. Thank you.
Perfect. Thanks, Cindy.
Mhm.
All right. Well, let me move us into the part of the agenda that I thought we were in, and pass it back to Heather to talk about our tax credit for care workers.
So if you haven't, if you're a provider, you've probably gotten an email from me about this requirement, and you might have emailed me back because we got lots of emails about this. It's a little challenging because this is, it's not a HICPUF requirement, right? It came from a bill, but we're involved in it. So how do you get the notice out and help people know what they need to do, but also we can only do so much. There's only so much we're able to respond to things here. So just a little bit of a refresher. There is a care workforce tax credit, and this includes child care workers, early child professionals, and direct care workers employed by long-term care employers in the Medicaid space. So it's a refundable tax credit, $1,200 per person. So there are some qualifying aspects of theirs. So they do talk about their income. So a single filer has to be 75,000 or less, 100,000 or less if they're joint filing. And just really have to know that you have to work as that child care worker or the direct care worker. I cannot speak on the child care aspect of that. It is different, but they have a lot of resources on their website about that. Um, Eligible care workers must have worked in a qualifying position in Colorado for at least 720 hours in the tax year. So this would be the calendar year of 2025. We go to the next slide. How will they know that you've worked 720 hours? Well, long-term care employers have to report the total hours worked by their employees in the calendar year to Department of Revenue. And so there is, Department of Revenue has a website or a page for this. They have a form. They seem to have had some upload challenges. They thought some stuff was ready to go and it wasn't. I've been communicating with them, but I can't log into the site to actually see what it looks like. So I'm trying to look for some screenshots or some stuff to help folks with that. But if you got an email, then you probably need to report, but might not. And that's kind of the important part to look there. It is very specific to employers. If you only have independent contractors, then you don't have to report. The tax credit is pretty specific that it is for an employee. And so the other questions that we've got is I'm technically a provider in this space, but I haven't done anything within 2025, then you don't have to report. If you don't have employees, you don't have to report. Department of Revenue has been very clear that, this is the first year. They're really trying to get it done and not enforce that penalty unless it really has to. And so that is my way of calling out there's a $500 penalty for this if you do not file a timely report. If they are looking for your report and they don't think they have it, they're going to reach out to you. What is going to happen is an individual taxpayer is going to file for this credit, and then they're going to go look for that verification, and that verification would be on your report. So they'll have to match those up. So there could be some outreach just to make sure. For CDOS, Consumer Direct Attendance Support Services, HICPUF, and the FMSs are providing that information. So in CDOS, that is not a requirement to do the hours. We would just ask CDOS employers to make sure that their hours are submitted and improved so that they show up on that, the number is counted there. And if you want to receive this credit, you have to file a Colorado individual income tax return. Even if you don't owe any taxes, you should still consider filing for this tax credit if you're eligible, because it could have some benefits for you. And now I'll tee up Brooke.
Yes, and so I mentioned this earlier, but we are having Get Ahead Colorado come to Friday's Compensation Benefits Action Group meeting. It will be recorded. We will post it to the Direct Care Workforce Collaborative website, but it's just join us for tax season prep presentation. It's going to be all things free resources for tax filing, information on tax credits, not just the direct care worker tax credit, but all other tax credits that you may be eligible for, how to see if you're eligible for them, and then how to go through that filing process. CDPH&E runs this. It's a bit of a public information campaign. This is their busy time of year, and so they're going to come share a presentation with us. There's going to be time for questions, and then follow up on individual circumstances as well. If you need that one-on-one support or have very specific questions, they offer that up as well. So again, Friday, January 16th at 10 a.m. And it's just going to be during that Compensation and Benefits Action Group meeting. They also have a tax webinar kickoff that goes more in depth of all the services. And I'm sure Angelica will share that registration link for you all on Friday. But if you aren't able to join us on Friday, I will work on getting the tax season launch webinar registration in the chat for you from Get Ahead Colorado. That's separate from us. That's not something we're hosting. It's something that they are doing themselves. And so another great way to keep in touch with them. And I just found it, so I'm going to drop that in the chat for you to sign up for that if you're interested. And Heather, I think I have just your resource slide. Anything of note here, or just drop it in the chat.
I just did, I've updated the FAQ. We're going to put another blast in the LTS SOCL newsletter, but check out the FAQ if you have some questions. Colorado Department of Revenues, that's where the form is you need to fill out. And I think that's it, and the actual language of the bill is in there. So that's all I have. If you have questions, send them our way. If we can answer them, that's great. If they're very specific to your situation, we can't give out tax advice, but we would encourage you to, contact a tax professional or do some outreach to Department of Revenue. That is
Perfect.
it.
Thanks, Heather. All right, really quickly, because we're nearing the end of our time together, and I want to make sure we have time for open forum for folks. So we are planning for Direct Care Worker Appreciation Week. This started as a governor's proclamation in 2023, and in 2024, our Direct Care Workforce Collaborative leadership team went through the joint resolution process to ensure that Direct Care Worker Appreciation Week is the first full week of April every year. It's different from the DSP week, Direct Support Professionals Week, that occurs in September. That's specifically generally geared toward IDD, folks working in the IDD field. And so we've kind of opened it up for all direct care workers across the spectrum, family caregivers, all folks kind of celebrated, and the language includes that. So suggestions for 2026 that we've gotten so far. We'd like to outreach some legislators for thank you videos or letters, get it kind of in front of them, make them look at it a little closer to do thank you videos and letters. Sample letters to the editor so folks can write into their local newspapers or their local, I don't know, we have like a little online newsletter here in Montrose that folks can write into. Reaching out to providers and employers who celebrated last year and hear from them what they did, what worked, what didn't work. And we'd love to learn how to get members more involved. And so if you're interested in getting a little closer to the action to help us plan for Direct Care Worker Appreciation Week, we will be spending all of our meeting on January 23rd, next Friday, for that Value and Awareness Action Group doing that and planning on that. But if you'd like to take it even one step further, we are asking folks to sign up if you're interested for a little subcommittee that'll meet kind of in the off months so we can continue to make sure that work is happening when we aren't in our action groups or quarterly collaborative meetings. So I'm just going to drop the interest form in the chat if you're interested in signing up for that. And then I'll also do the joint resolution language as well. If it's new to you or unfamiliar, you can take a look at the joint resolution and how we got to this point. But if you're willing to do an extra meeting or two in between time to make sure that we kick off Appreciation Week in April, we'd love to have you. I'm going to close the sign-up form probably in a week or two, and then we'll start scheduling a meeting or two in February. So yeah, that is just a quick highlight I wanted to do. We do like to take just a few minutes to call out. If you're available and willing, I would so appreciate if you fill out our feedback survey. That lets us know how we're doing, how relevant the content is. We also have a topic request form. So if you'd like to see a topic at future meetings that we weren't able to cover in the past, or we need a refresher on, we'd love for you to bring us some topics as well. We can work on getting presenters in. That's what helps us fill our agendas. And so we'd like to hear, one, how we're doing, and two, what we could do better. And topics that are interesting to you. Last few minutes here, last 10 minutes or so, we'd like to open it up to the floor. If you have any questions, resources you'd like to share, announcements, networking, anything that we can help with or you'd like to share, we just open the floor for a little bit here, and I'll leave you to it if anyone has anything. And if not, we always have something ourselves. So I'll let folks kind of stew on that for a minute while I share an opportunity on another work group that's related to the Children's HCBS Waiver Satisfaction Survey. So they are developing a children's waiver satisfaction survey, and they're working with Vital Research. This is a team outside of us. We've just been asked to kind of share this with folks. They would like to do a virtual work group of professionals to provide input, ideas, and expertise on working with children or children's waivers. So they are hoping to create a work group to have a few meetings, probably 2 to 4 times it looks like during that time period. And they would like to note that if you're a family member or you receive services, your child receives services, they'll be outreaching you in different ways. This work group is for professionals specifically, and then they'll kind of engage parents in a different avenue and a different venue for those different, more targeted conversations. And so let me drop the interest form in here for you. And again, all these links will be live in the slides that we post to the website. And they are kind of leaving this open a little bit longer for us. So if you have an interest in signing up for this, we'd love to do that. So And if there are no open forum announcements, questions, concerns, wonderings, I'll give a last call. We do want to drop just some additional resources to you. One thing that so these are kind of two new things. If you've been to any of the collaborative meetings lately, we've been sharing the federal changes to Medicaid website and also the Medicaid sustainability and Colorado's long-term services and support system. Those two websites are kind of where our communications team is providing updates and information. Both for all the federal changes and impacts of HR 1, and then also we are in budget session in the state of Colorado now too. I guess we're actually in legislative session now. And so being able to keep track of changes to Medicaid sustainability and the HCBS waivers and Office of Community Living, all that good stuff can be found there. We do have some legislative bill trackers that we continue to share each year because this is a busy time and folks are trying to keep tabs on all the things that are happening. So we have some links to the Colorado General Assembly. We've linked, typically Alliance will have a bill tracker. These may not be populated yet since today's the first day of session, so perhaps just bookmark these and take a look at them. Bell Policy Center typically has a legislative tracker, the Human Services Network of Colorado, and we'd love for you to share others. If there's others that you are finding that is a great place to get some information on all the legislative bills that are coming through, where they're at in the process, we'd be happy to share those out with folks as well. And again, might not be populated yet, might not be as up to date yet with today being the first day, but continue to check in with those and share any other great resources that you find. It's a lot of information to keep up with this time of year, but we'll do our best to centralize it for you. Rosemarie, when will this meeting be available on HCPUF's website? So we have to go through just some accessibility, make sure the slides are accessible, and then we go through and transcribe the video. So I would say probably early next week. Rosemarie, if that works. If you need access to, if it's the slides specifically that you're looking for access to, I can drop those in the chat for folks. Actually, let me just go ahead and do that. So you have access to the links sooner. And then the recording will be available early next week. I'll just share those with everyone here. All right. And I updated the access, so that should work for you all. If you have any issues with that, let me know. All right, I already gave you the link to the topic request form. I will mention that the next collaborative meeting will be Wednesday, April 8th, same time, same place. And we'll be accepting topics through the next couple of months. Have any updates on the access rule and all that good stuff. We'll follow up on a couple things that came up in chat today. And if you think of anything in the meantime, we'd love to have you send us those ideas. And we hope to see you at some action groups over the next couple weeks. This is my last minute plea to take that feedback survey to tell us how we're doing. Some additional resources for you that'll be live in the slides, and that is all I have for you. So if there's nothing else, thank you so much for being here. Happy New Year. It's so nice to see you in January. And yeah, we'll hopefully see you over the next couple weeks. Thanks, everyone.